My name is Ollie. I'm a speech and language therapist in stroke rehabilitation at Queen's Hospital.
Hi, my name's Ellen and I'm a speech and language therapist at BHRUT. I pursued a career in speech therapy, having kind of studied a bit of linguistics and then a bit of psychology, so things that were really involved in looking at language and people, and it seemed like a natural progression as a career to go into. As with a lot of people, I initially thought speech therapy was mainly about working with school-aged children, working in schools as children develop the language skills. But then through a bit of research and a bit of work experience that I did myself, I discovered that speech therapy had this huge role in acute hospital settings, which really just kind of sparked something in me, and is why I chose to follow that career path.
My job role does live up to my expectations, I reckon. I think it's been a bit of a challenging time with COVID-19 happening, but everything that I had hoped for being a speech and language therapist has come true, which is reassuring. I think that what I expected was being people-centred, people-focused, working in a clinical environment and being able to work with a ton of different professionals and keeping interested every day at work. So in that aspect, it absolutely has lived up to my expectations. I think in terms of surprises along the way have been COVID-19. I certainly didn't expect to start work during a global pandemic, but you roll with the punches and you crack on with it. So it's been a real roller coaster, but it's been a really enjoyable one, and I'm very grateful to have been there through it. So a typical day being a speech and language therapist on a stroke rehab unit is really varied. I'd say it changes day to day, week to week. Typically though, we would start with a rehab multidisciplinary team meeting where myself from speech therapy meets with occupational therapy colleagues and physiotherapy colleagues in an MDT meeting at the start of the day, where we talk about our patients that we have joint sessions for, that we have goal sessions for, and that we meet with families for. Then I would go on to see some patients and do some of those joint sessions or goal sessions, or see patients directly for one-on-one therapy or assessment. That might involve seeing patients for initial communication and or swallowing assessments, to see if they're safe for oral intake, but also to explore their communication from a wide range of communication difficulties, such as problems with language, so understanding and being able to express yourself, motor speech difficulties, so a weakness or change in someone's ability to articulate, voice disorders as well, so what your voice is sounding like, and cognitive difficulties that impact communication, so your thinking skills, your attention and concentration. So it can be quite varied. In a stroke rehab setting, patients tend to be quite complex. They have a range of needs that require ongoing neuro-rehabilitation. So a lot of the work that I do is working with those other therapists as well as the doctors, the medical team, to determine what kind of level of need they need going forwards, but also linking in with other teams such as the dietetics team, so working with patients who can't eat and drink and they need enteral or tube feeding. Working with the nutrition support team to determine whether someone would be appropriate for longer term enteral feeding, so that might be a tube in your stomach, or really a whole range of other professionals including neurologists, psychologists, psychiatrists. Really depends on what the patient needs, and it really does change day to day, and it's a real mix of those things.
So as in most kind of hospital trusts here, the speech and language therapists are rotational, which means that we work in different teams for a set period of time, maybe 6 or 9 months, and then move into a different area. So a typical day at the moment for me working in acute medicine would be, I start at 8 o'clock, I get in, I check for any new referrals we've had from the wards, have a look at the caseload and prioritise my day in terms of urgency, who needs to be seen first. I'll typically have a little catch up with the rest of the team just to make sure that we've spread everything out and the demands aren't all on one person, and then I'll head off to the wards, and that will involve reading patients' notes, speaking to their doctors and nurses, the patients themselves and their family members. And in acute medicine, a lot of what we do is around swallowing disorders. So I would then do a bedside swallow assessment to have a look and see whether there's any issues with someone's eating and drinking that may be leading to them getting things like aspiration pneumonias or chest infections.
So I think there are lots of challenges that come with the role of being a speech and language therapist in a hospital setting. Alongside all the benefits, I think it's really good to think of it as peaks and troughs, or it's not all glitz and glamour. There are challenges to our job working in a hospital. One obvious example and recent example could be the COVID pandemic. That has been a real challenge professionally and on a personal level as well. I guess a positive from that has been a really quick upskilling of my own skills, professional skills and experience working across a wide range of specialities. So those more challenging patient groups, so palliative care, so working with patients at the end of their life, as well as respiratory conditions, working with ventilatory support, and working with neurological patients who aren't getting that timely access to family that they usually would. So it's been a real strain, I think, on us as therapists, but also our patients. I think we encounter kind of conflict every day in our role, and that could include having a disagreement or conflict with a consultant who perhaps doesn't see your perspective of why someone isn't safe for discharge, for example. Lots of patients after having a brain injury may begin to lack capacity, so their ability to reasonably make decisions for themselves because of a cognitive impairment or a communication difficulty. For example, about where to go after being in hospital. Is it safe for them to go home? Can they call for help in an emergency? Or actually, do they have capacity to make those challenging decisions and would rather go home without that further rehab? So I think those real challenges come every day. Other examples could be perhaps providing a differential diagnosis of a communication or cognitive difficulty. I had a patient today that I'm working with who has oddities in her communication presentation that don't necessarily fit with a purely stroke presentation. So that brought a lot of conflict and disagreement and coming to a bit more of a conclusion and a plan with the consultant and myself to really remember that the patient is at the heart of it, and although you kind of encounter those difficulties, you can also learn to get over them and work more as a team.
The best bits I think about my job is getting to work with such a huge range of people, and that's the patients themselves, always from just such different backgrounds, different reasons that they're here, different problems that you may be trying to kind of help and improve their quality of life with, but also the other professionals. So depending where you are, you might work with lots of physiotherapists, occupational therapists, psychologists, doctors, nurses. There's kind of no end to the kind of variety, which I think is something that I really enjoy. No day is ever the same. And especially at the moment, I think one of the key roles that I've found, especially in the pandemic, is kind of being able to advocate for our patients that maybe have communication difficulties or their families haven't been able to come in and visit. I think in speech therapy, naturally everyone's a great communicator, and I think it's a strength that we've brought, especially in the last year.
I think it's really important to be resilient when working in healthcare, so kind of learning to deal with the peaks and troughs of day-to-day work, learning to deal with the highs of your job, but also coming to terms with managing those lows as well. So when patients perhaps don't do as well as you'd hoped or expected, but actually working with what you can do to support them when they're at their lowest or at a time that is really challenging for them and you as a therapy team. I think being really determined and quite persistent in advocating for your patients is really key as well. Kind of not giving up on them and to fight for them if you really have to. I think in being a really good staff member as well, the most important thing is your team and to work well as a team. Be a good communicator, be open-minded, be kind, and be open to learning things. I think after a couple of years of working, you realise that it's actually okay not to know everything about your job role, and just learn to accept that and be open to learning more, listening to people who do have more experience than you, but also at that time offering what experience you do have out there as well. So it's all about teamwork, I think, and being a really good staff member.
So my route into speech therapy started, I did GCSEs and A-levels. I picked quite broad, kind of non-specific A-levels of kind of English, maths and French, because I wasn't really sure what I wanted to do. And after my A-levels, I took some time out. I got a job. I worked waitressing for a couple of years, and then I started to study linguistics, which I really enjoyed, but partway through the course I was thinking there's something about it, it's not quite right for me. So I stopped that, worked again for a little bit, and then when I was around 23, 24, I went back to uni to do psychology and language science, and that is where I really found, I found my thing, which was really exciting. And then from that I finished, so it was a 3-year undergraduate degree, and I went in straight after that to do a 2-year postgraduate master's, which by the end of it you are qualified to be a speech and language therapist. Not everyone that I work with has taken the same route, so some people did an undergraduate degree, which is usually 4 years at undergraduate level, and then again you're qualified in the same way to start speech and language therapy.
I think when you're at school or when you're at sixth form, the most important thing or piece of advice that I would give is to keep asking questions. If you're not sure what a job involves, ask a question. If you want to hear more about a job role, then get in touch with someone to ask more questions. Just keep asking questions so that you know that you're going into the right career for you. And it's not being silly or coming across as stupid or I should know the answer to that question, because I ask questions all the time, and I think that's the best way of learning. I would say get out there and try to get as much experience as you can in a wide range of settings. So get in touch with your local hospital. Can they offer you any work experience? Get in touch with a local school to get experience of working with kids as well in the paediatric setting. Really get in touch with any and every team that you can, just to really show that you're committed to working in this kind of setting. You've had some people-facing experience and some real-world life experience as well. Like, I've worked in hospitals, I've had this day in a school, because that will really support you in your application in going into any healthcare setting really, but especially speech and language therapy. They would absolutely love to see that. And just keep going, be determined, because you can get there, you just have to put your mind to it.